Question 1. A 45-year-old patient with a history of myocardial infarction presents with sudden chest pain, diaphoresis, and nausea. Upon assessment, the patient is hypotensive and has an elevated heart rate. The ECG shows ST segment elevation. What is the first action the nurse should take? A. Administer nitroglycerin and morphine. B. Prepare for immediate cardiac catheterization. C. Administer aspirin and oxygen therapy. D. Perform a 12-lead ECG to confirm findings. Answer: C. Administer aspirin and oxygen therapy. Rationale: in cases of suspected STEMI, ST segment elevation myocardial infarction, immediate aspirin administration and oxygen therapy are critical to reducing thrombus formation and improving oxygenation to the heart muscle. Nitroglycerin and morphine may be used later, but these interventions should not delay the administration of aspirin and oxygen. Question 2. A 25-year-old woman at 32 weeks gestation presents with swelling in her legs, severe headache, and blurred vision. Her blood pressure is 160/100 mmHg, and urinalysis shows proteinuria. What is the nurse's priority action? A. Administer antihypertensive medications and monitor for changes. B. Notify the healthcare provider and prepare for immediate delivery. C. Assess fetal heart rate and administer magnesium sulfate. D. Offer reassurance and educate the patient about gestational hypertension. Answer: B. Notify the healthcare provider and prepare for immediate delivery. Rationale: the patient is exhibiting signs of severe preeclampsia with possible progression to eclampsia, headache, blurred vision, elevated BP, proteinuria. Immediate notification to the healthcare provider is necessary to initiate interventions to manage the condition, including potential delivery. Question 3. A 68-year-old male with a history of chronic obstructive pulmonary disease, COPD, and congestive heart failure, CHF, presents with increasing shortness of breath, orthopnea, and a productive cough with frothy pink sputum. His oxygen saturation is 86%. What should the nurse do first? A. Administer a bronchodilator and assess lung sounds. B. Administer oxygen and elevate the head of the bed. C. Prepare for intubation and mechanical ventilation. D. Auscultate for bilateral lower extremity edema. Answer: B. Administer oxygen and elevate the head of the bed. Rationale: the patient is presenting with signs of acute pulmonary edema due to CHF. The first priority is to provide oxygen and elevate the head of the bed to reduce the work of breathing and improve oxygenation. Other interventions can follow once the patient's oxygenation status is stabilized. Question 4. A 72-year-old patient with diabetes and hypertension is post-operative day 2 after undergoing hip replacement surgery. The patient suddenly becomes confused, restless, and agitated. Vital signs are stable. What is the nurse's most appropriate first step? A. Assess the patient's blood glucose level and administer insulin if necessary. B. Administer a sedative to help calm the patient. C. Call the healthcare provider to discuss the change in mental status. D. Review the patient's medications for potential side effects. Answer: A. Assess the patient's blood glucose level and administer insulin if necessary. Rationale: confusion and agitation in a post-operative patient with diabetes may indicate hyperglycemia or hypoglycemia. The first step is to assess the blood glucose level to rule out metabolic causes before taking further action. Question 5. A 55-year-old male with a history of alcohol abuse is admitted with symptoms of confusion, tremors, and diaphoresis. The patient is at risk for alcohol withdrawal delirium (DTs). What is the nurse's priority intervention? A. Administer intravenous, IV, lorazepam as ordered. B. Obtain a blood alcohol level and monitor liver function tests. C. Place the patient on continuous cardiac monitoring. D. Provide the patient with frequent reassurance and distraction techniques. Answer: A. Administer intravenous, IV, lorazepam as ordered. Rationale: the patient is presenting with signs of alcohol withdrawal, including confusion and tremors. Lorazepam, a benzodiazepine, is the treatment of choice to prevent alcohol withdrawal delirium DTs. Monitoring and supportive care are important, but should not delay the pharmacologic intervention. Question 6. A 50-year-old female with newly diagnosed breast cancer is undergoing chemotherapy. She presents to the clinic with complaints of extreme fatigue, nausea, and loss of appetite. The patient's hemoglobin is 7.5 g/dl. What should the nurse do first? A. Educate the patient on the importance of taking anti-nausea medication. B. Administer erythropoietin as prescribed and assess for signs of bleeding. C. Notify the healthcare provider of the patient's low hemoglobin level. D. Encourage the patient to eat small, frequent meals high in iron. Answer: C. Notify the healthcare provider of the patient's low hemoglobin level. Rationale: the patient's low hemoglobin suggests anemia, which is common in cancer patients undergoing chemotherapy. Immediate notification to the healthcare provider is essential for further assessment and possible intervention, such as blood transfusion or erythropoietin therapy. Question 7. A 40-year-old patient with a history of severe asthma presents with wheezing, chest tightness, and increased work of breathing. The peak flow measurement is 55% of the patient's personal best. What should the nurse do first? A. Administer a beta-agonist inhaler and reassess after 15 minutes. B. Administer oxygen therapy and prepare for intubation. C. Administer a corticosteroid injection and monitor for improvement. D. Have the patient use a spacer with their inhaler. Answer: A. Administer a beta-agonist inhaler and reassess after 15 minutes. Rationale: the patient is in moderate asthma exacerbation, and the first intervention should be the administration of a beta-agonist, e.g. albuterol, to relieve bronchospasm. Oxygen therapy and corticosteroids may follow if the patient does not improve with initial treatment. Question 8. A 28-year-old female with pre-existing hypertension is 28 weeks pregnant and presents with severe headaches, blurred vision, and abdominal pain. Her blood pressure is 170/110 mmHg. What should the nurse do first? A. Administer antihypertensive medication and monitor fetal heart tones. B. Initiate magnesium sulfate to prevent seizures. C. Prepare the patient for immediate delivery, regardless of gestational age. D. Monitor blood pressure for 1 hour before taking further action. Answer: B. Initiate magnesium sulfate to prevent seizures. Rationale: the patient is displaying signs of severe preeclampsia, which requires the administration of magnesium sulfate to prevent seizures and protect maternal health. Immediate blood pressure control and fetal monitoring can follow. Question 9. A 68-year-old male with heart failure presents with acute dyspnea and crackles upon auscultation. His oxygen saturation is 88%, and he is anxious. What is the nurse's first intervention? A. Administer IV furosemide as prescribed. B. Increase the oxygen flow rate and reassess. C. Prepare for intubation and mechanical ventilation. D. Auscultate lung sounds again and notify the healthcare provider. Answer: B. Increase the oxygen flow rate and reassess. Rationale: the patient is likely experiencing acute pulmonary edema. Increasing oxygen is the immediate priority to improve oxygen saturation and relieve dyspnea. Diuretics and further interventions can follow once the patient is stabilized. Question 10. A 32-year-old woman in labor has been pushing for 3 hours with minimal progress. The fetal heart rate drops to 90 beats per minute, and the mother is exhausted. What is the nurse's priority action? A. Continue supporting the mother and encourage further pushing. B. Notify the healthcare provider and prepare for a vacuum-assisted delivery. C. Administer a bolus of IV fluids and monitor fetal heart rate. D. Increase the maternal position changes and assess for fetal distress. Answer. B. Notify the healthcare provider and prepare for a vacuum-assisted delivery. Rationale. Prolonged labor and fetal heart rate decelerations may indicate fetal distress or an obstructed delivery. The nurse should promptly notify the healthcare provider and prepare for assisted delivery. Question 11. A 35-year-old patient with a history of seizure disorder presents with altered mental status, fever, and tremors after taking her anti-epileptic medication. What is the first action the nurse should take? A. Administer an antipyretic to reduce fever. B. Assess the patient's serum drug levels for toxicity. C. Notify the healthcare provider for further evaluation. D. Apply a cooling blanket to bring down the patient's temperature. Answer. B. Assess the patient's serum drug levels for toxicity. Rationale. The patient's symptoms may indicate drug toxicity due to the anti-epileptic medication. Serum drug levels should be assessed first to confirm this suspicion before taking other actions. Question 12. A 56-year-old patient with a history of stroke and atrial fibrillation presents with acute onset of severe left-sided weakness, slurred speech, and facial drooping. The time of symptom onset is unknown. What is the priority action? A. Administer tissue plasminogen activator, TPA, immediately. B. Perform a CT scan of the head to rule out hemorrhage. C. Administer aspirin to reduce the risk of clot formation. D. Check the patient's blood glucose level to rule out hypoglycemia. Answer. B. Perform a CT scan of the head to rule out hemorrhage. Rationale. In stroke patients, the first step is to rule out hemorrhagic stroke using a CT scan, as TPA is contraindicated in hemorrhagic strokes. The time window for thrombolytic therapy is also critical, so this should be assessed promptly. Question 13. A 44-year-old woman is diagnosed with a suspected acute gallbladder attack and presents with right upper quadrant pain, nausea, and vomiting. What should the nurse assess first? A. The patient's serum bilirubin and liver enzymes. B. The patient's cardiac history and risk factors. C. The patient's blood pressure and signs of shock. D. The patient's urine for signs of dark discoloration. Answer. A. The patient's serum bilirubin and liver enzymes. Rationale. Suspected gallbladder attacks should be assessed with laboratory tests to check liver enzymes, bilirubin levels, and other markers to confirm the diagnosis of cholecystitis or cholelithiasis. Question 14. A 30-year-old patient with cystic fibrosis presents with increasing dyspnea and a productive cough. The patient's oxygen saturation is 90% and the respiratory rate is 24. What is the nurse's priority action? A. Administer nebulized bronchodilators. B. Increase the oxygen flow rate and monitor for improvement. C. Assess lung sounds and administer IV antibiotics. D. Perform chest physiotherapy to promote secretion clearance. Answer. B. Increase the oxygen flow rate and monitor for improvement. Rationale. The patient's oxygen saturation is low, so increasing the oxygen flow rate is the immediate priority. Once oxygenation is stabilized, further interventions, such as bronchodilators, antibiotics, or chest physiotherapy, can be considered. Question 15. A 24-year-old woman presents with symptoms of a urinary tract infection, UTI. The urine culture reveals E. coli resistance to multiple antibiotics. What should the nurse do first? A. Administer the prescribed antibiotic and monitor for effectiveness. B. Notify the healthcare provider about the resistant organism and discuss alternative antibiotics. C. Recommend cranberry juice and increased fluid intake. D. Provide patient education on the prevention of future UTIs. Answer. B. Notify the healthcare provider about the resistant organism and discuss alternative antibiotics. Rationale. The presence of antibiotic-resistant E. coli requires the nurse to notify the healthcare provider immediately to discuss alternative treatment options. Question 16. A 66-year-old patient with diabetes and chronic kidney disease is receiving hemodialysis. The nurse notices that the patient has significant swelling in the lower extremities and a decrease in urine output. What is the nurse's priority action? A. Administer a diuretic as ordered to reduce swelling. B. Assess the patient's recent fluid intake and output. C. Notify the healthcare provider about the changes in condition. D. Document the changes and continue monitoring. Answer: C. Notify the healthcare provider about the changes in condition. Rationale: the decrease in urine output and significant swelling may indicate a complication, such as fluid overload. Immediate notification to the healthcare provider is necessary to assess for dialysis complications and adjust treatment. Question 17. A 42-year-old male patient presents with increasing agitation, confusion, and a change in mental status following a head trauma. What is the nurse's priority action? A. Monitor the patient's blood pressure and oxygen saturation. B. Assess the Glasgow Coma Scale (GCS) score and neurological status. C. Prepare the patient for a CT scan of the head. D. Administer analgesics to reduce agitation. Answer: B. Assess the Glasgow Coma Scale (GCS) score and neurological status. Rationale: the patient has signs of a potential head injury, and the priority is to assess the neurological status using the Glasgow Coma Scale to determine the severity of the injury and guide further interventions. Question 18. A 50-year-old patient with a history of schizophrenia is admitted with acute agitation and disorganized speech. The nurse assesses that the patient is at risk of harming themselves. What is the nurse's priority intervention? A. Administer antipsychotic medication as ordered. B. Place the patient on one-to-one observation. C. Use restraints to prevent injury. D. Provide a calming environment and allow the patient to rest. Answer: B. Place the patient on one-to-one observation. Rationale: the patient's agitation and risk of harm to themselves require immediate one-to-one observation. Restraints should only be used if absolutely necessary and after other measures are considered. Question 19. A 72-year-old female with advanced Parkinson's disease presents with severe rigidity, bradykinesia, and a new onset of dysphagia. What should the nurse do first? A. Administer a dopaminergic medication as prescribed. B. Assess the patient's swallowing ability and consider a feeding tube. C. Encourage oral hydration and soft foods. D. Notify the healthcare provider about the change in symptoms. Answer: D. Notify the healthcare provider about the change in symptoms. Rationale: the onset of dysphagia may indicate a worsening of Parkinson's disease or a new complication, such as aspiration risk or stroke. Immediate notification to the healthcare provider is necessary to reassess the treatment plan. Question 20. A 60-year-old male with a history of stroke presents with slurred speech, right-sided weakness, and facial drooping. His blood pressure is 180/100 mmHg. What should the nurse do first? A. Administer antihypertensive medication. B. Perform a CT scan to assess for hemorrhagic stroke. C. Start the patient on aspirin therapy to reduce clot formation. D. Reassess the patient's neurological status. Answer: B. Perform a CT scan to assess for hemorrhagic stroke. Rationale: in acute stroke, the first priority is to assess for hemorrhage with a CT scan, as TPA is contraindicated in hemorrhagic stroke. Once hemorrhage is ruled out, appropriate interventions, such as blood pressure management, can follow. Question 21. A 55-year-old patient with a history of cirrhosis presents with confusion, asterixis, and jaundice. The nurse notes an elevated ammonia level. What is the most appropriate first action? A. Administer lactulose as prescribed. B. Prepare the patient for a liver transplant evaluation. C. Administer diuretics to manage ascites. D. Place the patient in a quiet, dark room to minimize stimuli. Answer: A. Administer lactulose as prescribed. Rationale: elevated ammonia levels indicate hepatic encephalopathy, which is treated with lactulose to reduce ammonia absorption in the gut. Other interventions, like diuretics or liver transplant evaluation, may follow but are not the immediate priority. Question 22. A 32-year-old pregnant woman at 10 weeks gestation presents with vaginal bleeding and cramping. The patient's vital signs are stable, and the cervix is closed. What is the most appropriate nursing intervention? A. Administer Rh immunoglobulin if the patient is Rh negative. B. Provide emotional support and educate on signs of miscarriage. C. Prepare the patient for an ultrasound to assess fetal viability. D. Perform a pelvic exam to assess for cervical dilation. Answer: B. Provide emotional support and educate on signs of miscarriage. Rationale: in early pregnancy bleeding, it's important to offer emotional support and educate the patient about the signs of miscarriage. Rh immunoglobulin may be needed if the patient is Rh negative, but emotional support is the immediate priority. Question 23. A 45-year-old male patient with a history of diabetes and hypertension presents with sudden vision changes, confusion, and a blood sugar level of 45 milligrams per deciliter. What is the priority nursing intervention? A. Administer 25 to 50 milliliters of oral glucose. B. Administer insulin to control blood glucose levels. C. Administer a glucagon injection. D. Reassess the patient's blood pressure and heart rate. Answer: A. Administer 25 to 50 milliliters of oral glucose. Rationale: the patient is hypoglycemic, and the priority intervention is to administer glucose to raise the blood sugar to a safe level. Glucagon or insulin would not be appropriate in this situation, as insulin would further lower blood sugar. Question 24. A 68-year-old patient with a history of hypertension and atrial fibrillation presents with palpitations, shortness of breath, and a heart rate of 150 bpm. The patient is awake and alert. What is the nurse's first action? A. Administer an antiarrhythmic medication as prescribed. B. Perform vagal maneuvers to slow the heart rate. C. Obtain a 12-lead ECG and notify the healthcare provider. D. Prepare the patient for cardioversion. Answer: C. Obtain a 12-lead ECG and notify the healthcare provider. Rationale: the patient is experiencing a rapid heart rate, likely due to atrial fibrillation. The first step is to obtain a 12-lead ECG to confirm the diagnosis and guide treatment. Vagal maneuvers may be attempted, but the ECG and provider notification take priority. Question 25. A 60-year-old male patient who underwent coronary artery bypass graft surgery 24 hours ago is reporting chest pain, shortness of breath, and diaphoresis. What should the nurse do first? A. Administer nitroglycerin and reassess. B. Assess the patient's vital signs and oxygen saturation. C. Notify the healthcare provider and prepare for further diagnostics. D. Administer morphine for pain relief. Answer: B. Assess the patient's vital signs and oxygen saturation. Rationale: the patient's symptoms are concerning for potential complications, such as a myocardial infarction or pulmonary embolism. Assessing vital signs and oxygen saturation is the priority before initiating further interventions like morphine or nitroglycerin. Question 26. A 72-year-old female with osteoporosis presents with severe back pain after lifting a heavy object. The patient has a history of vertebral fractures. What is the nurse's priority intervention? A. Administer a muscle relaxant and monitor the patient. B. Assess the patient for signs of a new fracture and notify the healthcare provider. C. Encourage the patient to rest and apply heat to the affected area. D. Obtain an X-ray to confirm the presence of a fracture. Answer. B. Assess the patient for signs of a new fracture and notify the healthcare provider. Rationale. The patient is at high risk for fractures due to osteoporosis, and back pain after lifting could indicate a new fracture. The nurse should assess for signs of a fracture, such as point tenderness, and notify the healthcare provider immediately for further evaluation. Question 27. A 45-year-old patient presents with a sudden onset of severe abdominal pain, nausea, and vomiting. The patient's vital signs are stable, but the abdomen is rigid. What is the nurse's priority action? A. Prepare the patient for an abdominal ultrasound. B. Administer IV fluids and pain medications as prescribed. C. Monitor the patient for signs of peritonitis and notify the healthcare provider. D. Perform a full abdominal assessment and provide comfort measures. Answer. C. Monitor the patient for signs of peritonitis and notify the healthcare provider. Rationale. The patient's rigid abdomen and sudden abdominal pain may indicate peritonitis, a life-threatening complication. The nurse should closely monitor for signs of peritonitis, notify the healthcare provider, and prepare for urgent interventions. Question 28. A 24-year-old pregnant woman presents with persistent headaches, epigastric pain, and edema at 36 weeks gestation. Her blood pressure is 170/110 mmHg, and her urine is positive for protein. What is the nurse's first action? A. Administer antihypertensive medication as ordered. B. Assess fetal heart rate and prepare for immediate delivery. C. Initiate magnesium sulfate therapy to prevent seizures. D. Notify the healthcare provider and prepare for further diagnostic tests. Answer. C. Initiate magnesium sulfate therapy to prevent seizures. Rationale. The patient is presenting with signs of severe preeclampsia, and magnesium sulfate is the primary intervention to prevent seizures. After initiating magnesium sulfate, fetal heart rate monitoring and antihypertensive therapy can follow. Question 29. A 55-year-old male with a history of alcohol abuse presents with tremors, confusion, and agitation. The patient is at risk for alcohol withdrawal delirium. What is the nurse's priority intervention? A. Administer benzodiazepines as prescribed. B. Place the patient on a fall risk precaution and monitor for seizures. C. Administer intravenous fluids and electrolytes. D. Reassure the patient and offer non-pharmacologic interventions. Answer. A. Administer benzodiazepines as prescribed. Rationale. Alcohol withdrawal delirium can be life-threatening, and benzodiazepines are the treatment of choice to prevent seizures and manage agitation. Other interventions, like fall precautions, may follow once the immediate symptoms are controlled. Question 30. A 40-year-old patient with chronic kidney disease, CKD, presents with fatigue, nausea, and decreased urine output. The patient's potassium level is 6.2 milliequivalent per liter. What is the nurse's first action? A. Administer a potassium-wasting diuretic as prescribed. B. Prepare the patient for dialysis to remove excess potassium. C. Administer sodium bicarbonate to correct the acidosis. D. Monitor the patient's vital signs and ECG for signs of hyperkalemia. Answer. D. Monitor the patient's vital signs and ECG for signs of hyperkalemia. Rationale. A potassium level of 6.2 milliequivalent per liter is elevated, and the nurse should first monitor the patient for signs of hyperkalemia, including ECG changes. Immediate actions to reduce potassium can follow, but the priority is monitoring for life-threatening arrhythmias. Question 31. A 30-year-old pregnant woman at 28 weeks gestation presents with lower back pain and cramping. The patient denies any vaginal bleeding, but the cervix is noted to be 1 centimeter dilated. What is the most appropriate nursing intervention? A. Administer tocolytics to stop labor. B. Monitor the patient closely for signs of preterm labor and notify the healthcare provider. C. Encourage rest and hydration to prevent dehydration. D. Perform a pelvic exam to assess for further cervical changes. Answer: B. Monitor the patient closely for signs of preterm labor and notify the healthcare provider. Rationale: the patient is experiencing early signs of preterm labor with cervical dilation, and the nurse should closely monitor the patient for additional changes. Notifying the healthcare provider allows for early intervention, including possible tocolysis or corticosteroids. Question 32. A 72-year-old male with Alzheimer's disease presents with increased confusion, agitation, and combativeness. The nurse assesses that the patient is at risk for harming himself. What is the priority intervention? A. Administer sedative medication as prescribed. B. Increase the patient's level of supervision and provide a safe environment. C. Provide the patient with a calm and quiet environment. D. Contact the healthcare provider for further instructions. Answer: B. Increase the patient's level of supervision and provide a safe environment. Rationale: the patient's safety is the top priority, and increasing supervision and providing a safe environment are essential in preventing harm. Sedative medication may be used later, but the immediate priority is safety. Question 33. A 58-year-old female with a history of diabetes presents with dry mouth, increased thirst, and a blood glucose level of 450 milligrams per deciliter. What is the nurse's priority action? A. Administer insulin and reassess glucose levels. B. Assess for signs of diabetic ketoacidosis, DKA. C. Administer oral fluids to improve hydration. D. Notify the healthcare provider for possible hospitalization. Answer: B. Assess for signs of diabetic ketoacidosis, DKA. Rationale: the patient's elevated blood glucose and symptoms suggest the possibility of diabetic ketoacidosis. The nurse should assess for signs of DKA, such as fruity breath and rapid breathing, before administering insulin or fluids. Question 34. A 60-year-old patient with Parkinson's disease presents with a new onset of difficulty swallowing and coughing while eating. What is the priority nursing action? A. Encourage the patient to eat smaller, more frequent meals. B. Perform a swallowing assessment and notify the healthcare provider. C. Administer levodopa as prescribed to manage symptoms. D. Encourage the patient to perform throat exercises. Answer: B. Perform a swallowing assessment and notify the healthcare provider. Rationale: difficulty swallowing in Parkinson's disease could indicate dysphagia, which increases the risk of aspiration. The nurse should assess swallowing ability and notify the healthcare provider to initiate appropriate interventions, such as a feeding tube or speech therapy. Question 35. A 75-year-old male with a history of heart failure and chronic renal insufficiency presents with decreased urine output and swelling in his legs. What is the nurse's first priority? A. Administer diuretics as prescribed. B. Monitor the patient's vital signs and oxygen saturation. C. Notify the healthcare provider for further evaluation. D. Assess the patient's weight and fluid status. Answer: D. Assess the patient's weight and fluid status. Rationale: the patient is at risk for fluid overload, and assessing weight and fluid status is essential to determine whether the symptoms are related to heart failure or renal insufficiency. Fluid management will guide further treatment, including diuretics. Question 36. A 65-year-old female with a history of stroke presents with slurred speech, left-sided weakness, and facial drooping. The time of symptom onset is unknown. What should the nurse do first? A. Administer tissue plasminogen activator, TPA. B. Perform a CT scan of the head to rule out hemorrhage. C. Monitor the patient's vital signs and oxygen saturation. D. Check the patient's blood glucose to rule out hypoglycemia. Answer. B. Perform a CT scan of the head to rule out hemorrhage. Rationale. Before administering TPA, the nurse must rule out hemorrhagic stroke by performing a CT scan. Only ischemic strokes are eligible for TPA administration. Question 37. A 40-year-old male patient with a history of asthma presents with wheezing, difficulty breathing, and a peak flow reading of 40% of his personal best. What is the nurse's first intervention? A. Administer a corticosteroid inhaler. B. Administer a short-acting beta agonist, e.g., albuterol. C. Prepare the patient for intubation. D. Administer supplemental oxygen to improve oxygenation. Answer. B. Administer a short-acting beta agonist, e.g., albuterol. Rationale. The first-line treatment for an asthma exacerbation is a short-acting beta agonist, such as albuterol, to relieve bronchospasm. Oxygen therapy may follow if necessary, but bronchodilation is the immediate priority. Question 38. A 50-year-old patient with a history of schizophrenia is admitted with acute agitation and disorganized speech. The nurse assesses that the patient is at risk of harming themselves. What is the nurse's priority intervention? A. Administer antipsychotic medication as prescribed. B. Place the patient on one-to-one observation. C. Use restraints to prevent injury. D. Provide a calming environment and allow the patient to rest. Answer. B. Place the patient on one-to-one observation. Rationale. The patient's agitation and risk of self-harm necessitate increased supervision. Restraints are only used when absolutely necessary. One-to-one observation ensures safety, while further interventions are considered. Question 39. A 24-year-old woman presents with vaginal bleeding and abdominal cramping at 16 weeks gestation. What is the nurse's priority action? A. Assess the amount and characteristics of the vaginal bleeding. B. Administer Rh immunoglobulin if the patient is Rh negative. C. Offer emotional support and education about miscarriage. D. Prepare the patient for an ultrasound to assess fetal viability. Answer. A. Assess the amount and characteristics of the vaginal bleeding. Rationale. The first step in assessing vaginal bleeding during pregnancy is to assess the amount and characteristics of the bleeding to determine the severity and guide further interventions. An ultrasound may follow if necessary. Question 40. A 65-year-old male with a history of prostate cancer presents with lower back pain, fatigue, and unexplained weight loss. The nurse suspects metastatic disease. What is the most appropriate action? A. Administer pain medication and encourage rest. B. Notify the healthcare provider for further evaluation and imaging. C. Encourage hydration and monitor for signs of dehydration. D. Educate the patient about cancer-related pain management. Answer. B. Notify the healthcare provider for further evaluation and imaging. Rationale. The patient's symptoms may suggest metastasis, and immediate notification to the healthcare provider is necessary for further diagnostic evaluation, including imaging studies to assess the extent of the cancer.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.